Gum disease affects 1 in 2 adults in New Zealand. Wow. Let that sink in for a second. 1 in 2. That sounds like something we would hear a lot more about, doesn't it? Something we would check for regularly. Something we definitely wouldn't ignore. And yet, many people don't even realize they have it. Want to know why? Simple. Gum disease doesn't usually start with pain. It starts with something most people brush off. A little bleeding when brushing, a bit of bad breath, some tenderness, gums that look slightly red, nothing dramatic, nothing that screams emergency. So we all tell ourselves the same thing we always do. Maybe I brushed too hard. It's probably nothing. She'll be right. Sound familiar? The problem is that while we're busy getting on with life, gum disease can quietly keep progressing in the background. Now, before we go any further, let's quickly talk about what's actually happening. Don't worry, I won't get all scientific and boring about it. Well, let's think about it as spilling something on the kitchen bench. I'm sure we can all relate. You wipe most of it away, but there's still a thin film left behind. Our mouth works in a very similar way. Even if you brush well, a thin layer naturally forms on your teeth every day, all the time. That's completely normal. But if it's allowed to sit there, it starts to build up within a couple of hours. That's when we get that fuzzy feeling we sometimes notice when we rub our tongue on our teeth. That's called plaque. Plaque isn't food. It's a living community of bacteria. The longer it stays there, the more organized it becomes, adhering more biofilm and taking a more solid shape. And eventually it hardens. This is where we get tartar, or calculus if we are using the dental term. Think about it like cement. While it's still wet, it's relatively easy to clean up. Leave it long enough and it turns into concrete. A completely different story. Plaque works in the same way. Brushing and flossing are fantastic at removing plaque while it's soft, disrupting the building site before a solid foundation is set in place. But if we allow it to harden into tartar, your toothbrush can't remove it, no matter how hard you brush. And that's where the problem begins. Your gums are soft, highly sensitive, highly vascularized tissue. Now imagine that rough concrete-like deposit sitting against them day after day. Your body's natural response will be inflammation. That's where you start seeing bleeding, swelling, tenderness, the very things most people ignore. And there's the dangerous part. Because it doesn't hurt, many people assume it's harmless. Sometimes we even avoid brushing around the area because it bleeds. But inflammation doesn't always stay where it started. Over time, the gums can begin to pull away from the teeth. Small pockets starts to form and more bacteria gets in. And that's where we get tartar below the gum line. And eventually the bone supporting the tooth can start breaking down. Now we're no longer talking about gingivitis or inflammation. We're talking about gum disease. And once gum recession and bone loss occurs, some of that damage is permanent. And that is why regular visits aren't really just about getting your teeth to look extra clean. They're more about finding problems that we can't see. Because here's the reality. The scary thing about gum disease isn't that it's rare, it's that it's common. So common that many people stop thinking about the warning signs as warning signs. The sooner we listen, the easier it becomes to stop small problems from becoming bigger ones. Gum disease, it affects 1 in 2 New Zealanders.